You know, your skin is kind of like a living document. It tells a story. Every freckle, every mole, it's like a word or a sentence in that story. And yeah, most of the time, it's a pretty straightforward read, just the day-to-day business of being you. But every so often, the story can take a turn. So today, we're going to learn how to read it. We're about to dive deep into the science of melanoma, which is the most serious type of skin cancer. But don't worry, we're going to start with the basics. What are all these spots we see on our skin every day? And more importantly, what makes one a harmless freckle, another a simple mole, and a third, well, something you really need to pay attention to?
To really get this, we've got to meet the main character in this story, the tiny cell that's responsible for all the color in our skin.
Say hello to the melanocyte. Think of these as little pigment factories hanging out in the bottom layer of our skin. When you get a tan, that's just these cells kicking into high gear, pumping out melanin to protect you from the sun's UV rays. They're basically the heroes of this story. Until, well, they're not.
Okay, so let's clear something up right away. A freckle, or a lentigo, is really just a spot where you have a little cluster of these pigment factories. Simple enough. But a mole, or a nevus, is technically a benign tumor. I know tumors sound scary, but it just means a growth of these cells, usually caused by a super common and almost always harmless gene mutation. So most of our moles are totally fine. They show up, they stick around, and that's the end of it. But sometimes a mole has this, let's call it an atypical cousin, that shows up. And this one just looks a little off. And here it is, the dysplastic nevus. You can think of this as a mole that's starting to break the rules. It's usually bigger. The color isn't one solid shade, and the edges are kind of fuzzy and weird looking. Now, this isn't cancer, but, and this is a big but, it can be a direct precursor. It's a sign that the plot of our story is thickening.
So how does that even happen? How does a perfectly normal pigment cell start heading down such a dangerous path? Well, it all boils down to this incredible little drama playing out inside the cell's DNA.
It all kicks off with one little mistake, a single mutation, often in a gene you might have heard of called BRAF. The best analogy for this? Imagine the accelerator pedal in your car getting jammed to the floor. The cell gets this signal to grow, 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 and it just can't stop. But our bodies are incredibly smart. They have this brilliant built-in failsafe for exactly this situation. It's a bit of a mouthful. It's called oncogene-induced senescence. But really, it's just an emergency brake. The accelerator is stuck, so the body slams on the brakes, forcing that cell into a permanent timeout. It can't grow anymore. And that's why the vast majority of moles, even the ones with that first mutation, never turn into cancer.
It's a fantastic system, right? But it does raise a pretty terrifying question. What happens if a cell has a stuck accelerator and then something else comes along and just cuts the brake lines?
And that's exactly what happens. This is the second hit. Melanoma happens when another mutation comes along and disables that emergency brake. A common culprit is losing a gene called CDKN2A, which makes a protein that's a key part of the brake system. So now you've got the full picture. The accelerator is jammed down and the brakes are gone. The cell is now totally free to grow out of control. And that is melanoma. Okay, that whole story happening inside the cell is fascinating, but what does it actually look like on our skin? How can we possibly spot this stuff from the outside? Well, lucky for us, there's a really simple and effective toolkit we can all use. It's called the ABCDs of melanoma. It's a super simple guide to help you read your own skin. So let's break down what each of these letters really mean.
First up, A is for asymmetry. It's simple. Imagine you draw a line right down the middle of a mole. A normal, healthy mole is usually symmetrical. Both sides look more or less like a mirror image. But with a potential melanoma, the two halves just won't match up.
Next, B is for border. Healthy moles tend to have nice, smooth, clean edges. A red flag is when that border gets messy. Think irregular, ragged, notched, or even just kind of blurry and indistinct. C stands for color. Most normal moles are just one, even shade of brown. But melanomas often look like they can't make up their mind. They'll have multiple colors, shades of brown, black, maybe even patches of red, white, or blue. This mix of colors is a really big warning sign. Then we have D for diameter. Now, melanomas can definitely start out small, but a classic sign to watch for is a spot that's bigger than 6 millimeters across, which is about the size of the eraser on a standard pencil. It's a great, easy reference. And last, but honestly, maybe the most important of all, E is for evolving. This means change. Any mole that starts to change in size, shape, color, or height, or any new spot that shows up, is a reason to see a doctor. It means the story is actively changing, and you need to find out why.
All right, so let's say you use this toolkit, you spot something that looks suspicious, you go to the doctor, and it turns out to be melanoma. What's next? Well, the game plan for fighting it depends entirely on how far the story has progressed.
You see, melanoma tends to grow in two phases. First is the radial phase, where it spreads horizontally, kind of like a stain across the surface of the skin. At this stage, it's very unlikely to spread to other parts of the body. But then it can switch gears into a vertical growth phase, where it starts to dig down deep into the skin's layers, and that's the dangerous part. That's when it can reach blood vessels and lymph nodes and gain the ability to travel.
This is exactly why catching it early is so incredibly important. A patient's prognosis is almost entirely based on how deep that tumor has grown. It's a measurement called Breslow's depth. The rule is simple. The thinner the tumor, the better the chances. And the treatment plan follows right from there. If it's caught early when it's still thin, a simple surgery to remove it is often a complete cure. For deeper tumors, doctors will also check the nearby lymph nodes to see if it's started to travel. And for cases where it has spread, we now have these amazing modern treatments, like targeted therapies that go right after that BRF mutation we talked about, and immunotherapies that basically take the brakes off your own immune system so it can fight the cancer. So there you have it. The story that's written on our skin is a complex one, for sure. It starts with just one single cell and can become this incredibly complex disease. But it's a story that has very clear chapters and very obvious clues. And knowing how to read those early chapters, using those ABCDEs, is the single most powerful tool any of us have to change how the story ends. So the only question that's left is, what's your skin telling you?